Hi, my name is Gil. I'm a tutor for the USMLE Step 1 on Wyzant, and we're going to do a session today to show you what my sessions are comprised of. And I have with me today Lydia. I have been tutoring her for a couple years, and she's going to introduce herself.
Hi everyone, my name's Lydia. Um, he has been tutoring me for a couple years now, and I recently just graduated with my doctorate from the University of Southern California, USC. And he really helped me like get through this entire process, and I'm really thankful. And I feel like he is like a great tutor, so I'm really glad that he is part of WeSend now. So
Thank
thank
you so much for those kind words, Lydia. So my as she said, my profile is on Wyzant, and basically you just have to look for the USMLE Step 1 tutoring, and I should come up. My profile should come up there, and my bio is on there as well. But I'm just going to add some footnotes to my bio, so I'm going to talk a little bit about that before we get started on the cases. So my education and experience right now are at an intersection between the basic science and the clinical reasoning. My education at the University of Arizona in Tucson, Arizona, I got a BA in chemistry with a minor in physics. I also worked for the Department of Physics for 2 years as a teaching assistant. I taught well, I didn't teach, but I was a TA for the general physics with calculus course. I held office hours. I tutored the students. I helped them with the material. I graded their exams. I was also involved with two engineering departments, material science engineering, as well as the aerospace and mechanical engineering. At that time, I was in charge of the computer lab for the undergraduate and the graduate students at the aerospace and mechanical engineering. I also attended the University of Arizona College of Medicine in Tucson. I completed most of the basic sciences. I recently graduated from Southern California University Health Science. I actually my graduation was just this past December. So I have 20 years experience in tutoring, and as I said, I'm on Wyzant here. Look for my profile, and I've taken the discussions that we focus on. The cases we focus on are based on the NBME as well as in the U World. So here are four exams that I have taken in the NBME. My average score is greater than 95%. For the U World Sim exams, which I've taken many, my average score is greater than 97%. So the main focus of this video here is to show you what a session of tutoring consists of. So we're just going to dive right in. Um, and prior to the session, I asked Lydia what she was interested in learning about, and she wanted to learn about miscellaneous multi-systems. So we're just going to dive right into the first case, which is a 3-year-old boy that is brought in with generalized seizures. And we do a physical exam and we notice that he also has hypopigmented patches on his skin. So we do an MRI, and this is the MRI that we get. So if you notice, you have the tumor growths here in the ventricles. They're actually extensions from the ependymal cells. You also have some tumors in other areas. These are calcified. And the question asks, so which of the following is the most likely underlying cause of this patient's brain lesions? What do you think, Lydia?
I think the answer will be A.
A, benign hematoma formation. That is exactly right. So for this case, you would need to memorize that there is a tumor suppressor gene called Hamartin. And when this gene is mutated, it causes overgrowth of tissue, specifically in the ependymal cells as well as in the skin. The inheritance pattern of this mutation is autosomal dominant. And basically, what you have, the reason the baby is having seizures is because this extra tissue allows for the synaptic signals to travel along the hemisphere and even to cross across the hemisphere. This is why he's having generalized seizures. And this disease is called tuberous sclerosis when they have hematomas as well as the skin hypopigmented patches. So let's go to the next case. Next case is a 32-year-old woman that comes in with flank pain. And so we do an ultrasound and we notice that she has uh, a kidney tumor, and the tumor was eventually taken out, but at the time of the ultrasound, we checked the left side, because this was on the right side. We checked the left side, and we noticed that she had a tumor there as well. So she had bilateral kidney tumors, and the tumor, when we did a biopsy of it, consists of blood vessels, as you see here, some smooth muscle here, and mostly it's a lot of adipose tissue. So these tumors are called angiomyolipoma. So angiomyolipoma. So when you have a patient with bilateral angiomyolipomas, what you need to consider is that the patient, there is like a 90% chance, the incidence of this tumors is that it comes from the disease tuberous sclerosis. So you need to pretty much say the patient has tuberous sclerosis. Okay. So now the question asks, this patient is most likely to have which of the following additional findings? So what should you look for? Okay, Lydia, what do you think?
Or B.
B, brain hematomas as ash leaf skin. That's exactly right. So we need to look for brain hematomas because we want to be able to prevent any signs and symptoms coming from the brain. The reason they call it ash leaf skin patches is because the patch looks like a leaf and it's ash because it's hypopigmented. Okay, so let's go to the next question, which is a infant that is brought in with as we look at the infant, right away we notice, of course, that he has a protrusion from his abdomen. But what we notice first is that he has a clenched fist, and then his fingers are overlapping in such a way. Both hands are like that. That is classic for trisomy 18, which is, well, I just gave the answer away. Well, that's okay. We'll ask Lydia anyways what she thinks it is. What do you think it is, Lydia?
D.
Right. So it's trisomy 18, so 47, because she has a trisomy and the chromosome is 18, and it's a female because usually it's more common. Trisomy 18 is more common in females than it is in males. Okay, so let's go to the next question, which is here's the answer. So basically what I was saying is the clenched hands with overlapping fingers. You have the omphalocele protrusion of the bowels in a sac in along the near the umbilicus, and that was the correct answer. So now let's go to the next question. And so we have another infant that is brought in um, that has some similar characteristics. He does have an omphalocele, we notice on physical exam. He also has a cleft lip and palate. He also has a protrusion on the scalp right in the midline. So all of these are midline abnormalities, and that is classic for the trisomy 13. Okay. And trisomy 13 is, I just gave you what the trisomy is, Lydia, so you should know what the name of trisomy 13 is. What is the answer?
F.
I'm sorry?
F.
F, that is correct. Patel syndrome. So this is Patel syndrome, and Patel syndrome is a lot worse with respect to signs and symptoms and life expectancy. Normally, these babies die in utero. 95% will not make it. They die in utero. The ones that do, the ones that are born alive won't live past 6 months. Whereas the Edwards syndrome, trisomy 18, they tend to live a lot longer. And there are other severe signs and symptoms for Patel that you would notice that you may see. They may have polydactyly and they may have holoprosencephaly. As you know, holoprosencephaly basically means that he or she does not have a brain. So The sign symptoms are pretty severe for Patel syndrome. Okay, so let's go to the next question, which is this one here. So we have an 8-year-old that is brought in. Mom is concerned because he's beginning to have weakness in his hands. Dad notices also, but mom specifically notices because she started beginning to have those same symptoms a few years ago, and now her child at 8 years old is having the same types of signs and symptoms. So when we do a physical exam on the child, we percuss the thenar eminence, and we notice that it takes long for the thumb to abduct, and we notice that it takes a long time for it to relax. Okay, this is classic. This is classic myotonic, which is the failure of the muscle to relax in a normal time. And the child has myotonic dystrophy actually. And first, I'm going to ask Lydia what she thinks the answer would be. Further workup would most likely reveal which of the following. So if we did further workup, what would we see, Lydia?
I believe it's A, expanded
That
trinucleotide repeats.
that is correct. So basically, myotonic dystrophy is an expansion of the chromosome, the trinucleotides at the end of the chromosome. And as you know, although the most of the diseases with trinucleotide repeats, this is no different, will show anticipation. And as you know, anticipation means that as you see, the mom is beginning to have the signs and symptoms, but when she gives off the offspring, because it's an autosomal dominant disease, the offspring will have many more nucleotide repeats, and therefore they will have more severe signs and symptoms. And the symptoms will occur at an earlier age, as we see in this child being 8 years old. So, and this is just a graph of showing how the repeats will expand with every generation. Okay, so let's go to the next case, which is a this is a let me click on it real quick. So when we do this, you're gonna be able to see everything that I'm seeing, but right now this is the only thing I can show you. So we have a 46-year-old woman that comes in with nosebleeds, and so we examine the gums, and the gums are swollen, and they have ecchymosis. So we're thinking, okay, there's some of the smaller blood vessels in the gums are breaking in, and this is why the patient is bleeding. This is classic for vitamin C deficiency, as you know. And the mechanism of that, first we'll ask Lydia what she thinks is the right answer. Which of the following mechanisms most likely accounts for this patient's examination findings?
B, abnormal proline hydroxylation.
Abnormal proline hydroxylation. Very good. So basically, it is vitamin C deficiency, as I said. And what you see, let me just go to the answer here. Abnormal proline. So basically, the pro-alpha chain, once it's synthesized in the ER, it must be hydroxylated. It must be hydroxylated before it can form the procollagen. And the amino acids that are hydroxylated are proline and lysine. So in this case, I mean, they could have put abnormal lysine hydroxylation as well as an answer. And the enzyme that does the hydroxylation uses the cofactor vitamin C, and without it, the patient is unable to make produce the hydroxylation, unable to make the procollagen, does not have the collagen. Therefore, his vessels are weak, and that is why they burst. Okay, so let's go to the next question, which